Organ transplantation. Think of a couple reasons why you might need an organ or tissue transplant, then click to compare your reasons. You may need an organ transplant if one of your own organs has failed. This can happen because of illness or injury. Definition: kidney transplanted from the body on the left to the body on the right. When you have an organ transplant, doctors remove an organ from another person and place it in your body for the purpose of replacing a damaged or absent organ. For example, doctors may perform an operation that places a healthy kidney in your body. The transplanted kidney takes over the work of the kidney that stopped working. Most commonly transplanted organs and tissues are. Before you click, make a list of some common organs that are transplanted. Then click to compare your answer. Most commonly transplanted organs and tissues are heart, kidneys, liver, lungs, pancreas, intestine, and skin. Bones, tendons, cornea, heart valves, veins. Worldwide, which organ do you think is most commonly transplanted? The kidney. Types of transplants: autograft. A transplant of tissue to the same person. For example, skin grafts. Treatment of tissue before returning it. Stored tissue, for example blood, stem cells. Types of transplant: allograft. A transplant between two genetically non-identical members of the same species. Most transplants are allografts. Complications: requires immunosuppressants to prevent an immune response, but these drugs makes the body vulnerable to pathogens. Types of transplants: isograft. A subcategory of allografts involves a transplant from a donor to a genetically identical recipient, such as an identical twin. Does not trigger an immune response. Types of transplants: xenograft and xenotransplantation. A transplant from one species to another. For example, porcine, pig, heart valve transplants, common and successful. Complications: often dangerous because of the increased risk of non-compatibility, rejection, and disease carried in the tissue. What do you think is a major challenge for a successful transplant? What do you think is a major challenge for a successful transplant? Click to compare your answer. Transplant rejection. This is when the recipient's body turns against the new organ, causing it to fail. People who have transplants must take drugs to suppress the immune system for the rest of their lives to help keep their bodies from rejecting the new organ. Solution: serotyping to determine the best donor-recipient match and the use of immunosuppressant drugs, but remember that they compromise the entire immune system. Types of donors: 1. Deceased. These are donors who have been declared brain dead and have indicated that they wish to donate their organs. Organs are kept viable, alive, by ventilators or other mechanical mechanisms. Types of donors: 2. Living donors. A living donor donates a renewable tissue, cell, or fluid. For example blood, skin. Donates an organ or part of an organ in which the remaining organ can regenerate or take on the workload of the rest of the organ. For example, primarily single kidney donation, partial donation of liver. Bioethical issues: transplant tourism, organ harvesting. Wealthy individuals go to poorer nations and buy organs for transplantation. Organ harvesting. Organs are taken from living or deceased individuals without their consent and sold for transplantation.